Hey there, and welcome back to the Deep Dive.
Hello.
Today, we're looking at healthcare systems, specifically comparing the U.S. and India. And we're doing this based only on one source, a short YouTube clip you sent us.
That's right. And our aim here is really just to unpack what this one clip says. It focuses quite a bit on this tension between advanced technology versus, cost and access.
Yeah, and the source draws some pretty specific contrasts, maybe even surprising ones, based on the speaker's view. So let's get into what the clip presents.
Okay, so the clip jumps right in with a question. U.S. or Indian healthcare, which is more advanced?
And the speaker's initial take?
Well, the speaker says, yeah, in many ways, the U.S. is very advanced, technologically speaking.
Technologically. So the source points to things like the latest treatments being available. If something exists, you can probably find it there.
Exactly. Technology, availability of treatments, those are highlighted as U.S. strengths in the clip. But, and this is a key but from the source, the speaker specifically says they wouldn't call the U.S. system very advanced when it comes to like insurance or how medications are managed.
Ah, okay. So the source distinguishes advanced tech, yes, but the systems around it, payments, prescriptions, maybe less so? That's interesting.
It is. It suggests the source sees a kind of disconnect between the medical science and the bureaucracy or the financial side.
Right, which seems to lead straight into the next big point the source makes about the U.S. affordability.
It does, yeah. The speaker really emphasizes this. The tech is advanced, the treatments are there, but, quote, doesn't mean it's affordable.
So the source links that high-tech aspect directly to high costs for patients.
That seems to be the connection the clip is making. Availability is high, but affordability, well, that's presented as a major issue.
Okay, so that's the U.S. picture, according to this clip. How does it then portray India?
Well, the main contrast drawn in the source is affordability. It states pretty clearly that in India, you can get advanced treatments too, but at a much more affordable price point.
More affordable. That seems to be the key difference highlighted for India. Advanced care, lower cost.
That's the central argument the speaker in the clip puts forward for India, yes.
But it's not quite that simple, is it? The source adds a bit of nuance there about India as well. Yeah. Something about timing?
Yes, exactly. An important detail. The speaker mentions that specifically in their own field of expertise.
Okay, their specific field.
Right. India is maybe 7 to 8 years behind the U.S., not in having the treatments exist, but in terms of them becoming, widely available or mainstream.
Ah, I see. So treatments might be available and affordable, but perhaps in specialized centers, and it takes longer for them to become standard practice across the board compared to the U.S.
That's the implication, yeah. The source brings in that time lag as another key difference, at least for certain advanced treatments in that speaker's area.
Okay, so let's try and summarize what this single source, the clip we looked at, is claiming. For the U.S., technologically top-tier treatments are generally available, but big struggles with affordability. And the source is critical of how things like insurance and medications are handled, calling that part less advanced.
Correct. And then India is presented as having advanced treatments available at a much lower cost.
Right. Affordability is the key advantage highlighted.
But with that caveat we mentioned, a potential lag, maybe 7 to 8 years in the speaker's field, for those advanced treatments to become really mainstream compared to the U.S.
It really does put a spotlight on a tough balancing act in healthcare, doesn't it? Based just on this one perspective.
Yeah.
It raises a question for you, the listener. This tension between having the absolute latest tech, making it affordable, and how long it takes for breakthroughs to become routine care. What does this comparison suggest about the bigger global challenge of actually delivering advanced healthcare effectively to everyone?
Definitely something to think about.